Hello, stakeholders. My name is Ebele Onyanose from Brandman University. The purpose of this video is to present to you an evidence-based practice project plan in healthcare setting that requires the ability to effect change. My proposed CSP intervention is the impact of using educational brochure to teach blood sugar control among middle-aged African American diabetics. Identification of stakeholders. My key stakeholders are patients, providers, payers, pharmaceutical firms, and policymakers, which are the 5 Ps. Brief description of the stakeholders. Patients are the recipients, physicians are the providers of the Medicare. Health insurance sells health coverage plans directly to patients or indirectly through employer or governmental intermediaries. Pharmaceutical firms develop and then market medications which are prescribed by the physicians to treat patients. Government subsidizes healthcare for the elderly, the poor, and the disabled. The role of each policymakers. 1. The role of each stakeholders in the implementation plan project. Policymaker. The policymaker is a synonym for Department of Health or governmental responsible for health of the population. They establish the framework within which healthcare is provided to the individuals. The policymakers aggregate data from patients, providers, and payers to develop population-level metrics that inform their health and health economic policies. Crucial questions are answered with the policies, which are who is eligible to receive care, what care services are provided, how, where, and by whom, how are the services paid for, are the services being delivered well, are they accessible, are the needs of vulnerable or marginalized populations adequately served, what healthcare concerns do we need to plan for next? The patients. Patients have ethical duty over their health and towards monitoring costs. It is reasonably assumed that healthier lifestyles will lead to lower healthcare costs. In view of this, companies like Walmart with World Health Organization have stopped hiring employees that smoke to reduce healthcare-related costs. Sometimes MDs are accused of over-recommending diagnostic tests. However, this practice may be as a result of patients demanding multiple tests, even some of them are not necessary. The interesting thing with patients is that as technology increases, patients with insurance want the newest, most advanced and expensive treatment that their insurance may not cover. Physicians sometimes succumb to the request. Providers. Providers operationalize the care delivery within this policy framework. They provide health services to patients and maintain health information about them. The providers coordinate patients' care with other providers as care team members. Many providers are independent and manage their own business or operations and finances, which physicians have an obligation of beneficence to do whatever is necessary or beneficial for the patients. The payers. The payers operationalize the financial elements of policy framework. They enroll patients as beneficiaries and procure care services from the providers on behalf of their patients. They also must take on the task of ensuring the financial sustainability of the care program and report to the policyholders. The pharmaceutical firms. Pharmaceutical firms develop and make medications which are prescribed by the physicians to treat patients why government subsidizes healthcare. Educational theory and conceptual framework. Use of educational brochure in teaching diabetic control have utilized different patient education theories and strategies that have been well developed or described in the literature. This conceptual framework has highlighted strategies that can be used in different healthcare or community-based settings, including informal learning opportunities, cultural relevant problem-based awareness, and ongoing support for sustainable blood sugar control among middle-aged African American diabetes that are currently undergoing treatment. Each of these three programs may have had a different context, format, or primary goal. However, they are all found as the empowerment approach to diabetes education and care, designed to meet individual patient needs while taking advantage of the experiences of groups of patients to provide support and assistance to each other. Educational intervention. Using educational brochure to teach blood sugar control among middle-aged African American diabetics is recognized as a fundamental component of diabetes care. The goal of educational brochure is to help patients acquire knowledge, information, self-care practices, coping skills, and attitudes required for the self-management of diabetes. Several services and meta-analyses have found educational brochure use to have a positive impact on overall health care, including psychosocial stability of the patient. The impact is specifically pronounced in diabetes knowledge and improving blood sugar monitoring, dietary, exercise habits, food care, medication compliance, coping, and overall glycemic control. Implementation plan. The use of educational brochure in teaching blood sugar control has been implemented using a variety of methods. It has been found to be effective as improving diabetes management outcomes. Tang et al. 2015 demonstrated that the use of brochure as educational tool is most effective, resulting in a greater treatment satisfaction and is exceedingly easy in promoting lifestyle changes. Providing diabetes education Providing diabetes education by certified diabetes educators using appropriate technology such as brochure can improve the quality of life of the patients. Attached is my reference and the sketch. Thank you so much.